Hi, I'm Jenny. I'm one of the Breastfeeding Peer Support Coordinators here in Dumfries and Galloway, and together with Andrew we'd like to welcome you to this breastfeeding session. I'm sure there's many questions that you have regarding feeding your baby, and hopefully by the end of this session some of them may be answered, but should there be anything else that you wish to ask, please do not hesitate to contact myself or Andrea to arrange a phone call or an online chat.
We want you to feel confident at the end of this session, but as Jenny says, if you do have any questions, then please never hesitate. There's never a daft question. So there are many benefits to breastfeeding. It's free, bonus, reduces the risk of developing breast and ovarian cancers for mum. There are so many benefits for mum, for baby, for the environment, for the family. But for mum with the breast and ovarian cancers, reduces the risk of osteoporosis in later life and the risk of heart disease in later life. This is a bonus. I'm not bitter because I'm still waiting, but you burn up on average about 335 calories at least a day if you breastfeed. This is one of the most important things as well. Breastfeeding is about the nurture side of things. It's not all about what your baby gets from food. It's about the time you have to spend with them. You produce a hormone called oxytocin, which, as well as letting the milk down from your breast into the baby's mouth, also has a positive effect on your mood, but it just helps calm you and the baby down. This is another big bonus. Your periods might stay away for longer. Okay? For baby, helps give them a healthy immune system. Your breast milk changes. I'll go on to show you the difference in what's in breast milk and what's in formula milk. Helps reduce the risk of childhood obesity. You feed your baby when they're hungry, not just because we're looking at a clock, not just because we're timing things. So that, as long as that goes into the same sort of behaviour when you are then introducing solids and things after 6 months, then that can help reduce the risk of childhood obesity and for the same reasons the type 2 diabetes as they grow older. Lots of different infections that breast milk helps prevent because of the antivirals, the antibodies in the milk. Protects against tooth decay. Now, there was a lot of stuff in the media about, if you breastfeed your baby overnight, then that affects their teeth, but actually it lays down calcium deposits and it's really healthy for your baby's teeth as they grow older. Again, protects against tummy bugs and infections. This is especially true for premature babies. It helps protect against allergies, which can develop it with asthma, eczema, hay fever, things like that. Reduces the risk of some childhood leukemias, and one that we never like mentioning just now, but it's so important, it also helps reduce the risk of sudden infant death syndrome. We all have an alert system in our brain, and because breastfed babies are fed that wee bit more often, that alert system comes into working order more often. So they're more weak, their swallowing reflexes, all the reflexes are working more often, and reduces the risk of heart disease in adulthood. These are not exhaustive lists, these keep growing and growing. What's in your baby's milk? So there are all these goodies. They help baby grow, they help baby fight infections, along with so many other things. Formula is not it doesn't have living cells in it, so it doesn't change. It doesn't change as the baby grows older, and it doesn't change during a feed. It stays the same temperature, whereas everything changes with breast milk to benefit the baby.
So skin to skin, really, really important time for yourself and your baby. Your baby will be put onto your chest, rubbed down, wrapped in with a towel, and it's an amazing time. It really kicks off that bonding. It helps regulate your baby's heartbeat, helps regulate your baby's temperature, and usually within the first hour, your baby will look for feeding for the first time. It also is a really good time for your baby to start building its immunity, because your baby's hand will be touching your skin, picking up the bacteria off your skin, touching its mouth, which will be then going into its tummy, to obviously start the process that you build between yourself and your baby of building up that immunity. Colostrum is what we class as the start of our milk supply, and it's something that we start to make during our pregnancy. It's packed full of antibodies, packed full of nutrients, and it's just what your baby needs. It has a laxative effect to give a good clear out of the gut. But we do worry as moms because we worry about how much milk we have. Colostrum does come in small amounts, but it's adequate for your baby within these early hours. This is the size of your baby's tummy for the first 24 hours after birth. It holds 5 to 7 mils of milk, and I really want you to remember the size of your baby's tummy. Your baby is not looking for volume. Your baby is getting quality rather than quantity. So how do we know that our babies are hungry? Most people would say if your baby's crying, your baby's hungry. But crying is actually the last resort, and your baby shows signs before it gets to the frustrated, upset stage. So we have early feeding cues, and you'll hear about us talking about feeding cues when you have your baby. You'll see your baby stirring, you'll see your baby's mouth opening, hand will come to the mouth, tongue in and out, rooting round to the shoulder. These are all signs that your baby's possibly looking for feeding. So I would encourage you to key into your baby, pick your baby up, and try to feed your baby if you see any of the early signs. Crying is usually the last resort, and sometimes it can be a little bit harder to feed babies when we get to the crying stage, because like us, they get a little bit hangry too. So if you can get them earlier, then it's much more beneficial. I always say, watch your baby, don't watch the clock. We as adults eat and drink when we are thirsty or hungry, and we shouldn't be expecting our babies to do something we wouldn't do ourselves. And a lot of people put babies onto a clock, so we say a baby feeds 3 hourly or a baby feeds 4 hourly. And if somebody told me right now that I couldn't have a drink for another 4 hours, obviously if it was a warm day as well, that would be quite frustrating. So it's really important we look at our baby's cues and we key into them. And if you've just fed your baby half an hour ago but your baby's looking for food again, that's okay. Your baby's thirst and hunger comes from the milk. So it's really, really important we acknowledge this, and we do not try to put them on a time schedule so early in life when they have no understanding about what life's about and time schedules. So please respond to your baby, because that's also really important for our milk supply.
Okay, so what does your baby actually get during a feed? What is their behaviour like? All I have here is some oil and water. It's remembering that list we talked about that had all the goodies in milk. Now in the early days you notice babies going on, and it's all about the kind of mechanics of getting breastfeeding going. Once your milk starts to mature, we sometimes talk about it on day 3, 4 or 5 as your milk coming in. Your baby's feeding pattern might change. The routine is a bit of a bad word when it comes to breastfeeding. Babies don't go into a routine, but the way they feed, the way that the milk that they get will change. So when a baby first goes to the breast, what you're noticing is that they're going on quite fast. Now what that does is that gets the prolactin, your milk producing hormone, activated. It releases oxytocin, which is the love hormone, so helps with bonding, but also helps that milk be let down through your breast and into the baby's mouth. So at first a baby will go on quite fast, and this is getting the mechanics of things going. So they'll go on quite fast, and this is them getting their thirst quenching part of the feed. This is quite a short time. Some women notice that they get quite a strong letdown feeling, which can be a tingly feeling, or it can be quite a pronounced feeling. Other women are not so aware of it. So this is when you see that you're getting more, I don't want to say watery because it's still got lots of goodies in, but it's the more thirst quenching part of a feed. So if you have a warm day like we're having at the moment, if you have a warm day, you might find that your baby wishes more of that. What you don't want is for them just to have a full feed on this and go from side to side to side, because if they do that, their wee tummies might be a bit upset. You might find that they're not putting on the weight that is expected, even though babies put on weight at different times. So it's really important that they then move on to the second stage of the feed. So the second stage of the feed is when babies slow down. So it might be a couple of sucks and a swallow, a couple of sucks and a swallow, a couple of sucks and a swallow. Now this might go on for how long is a piece of string, but this is the longest part of the feed. Okay, what you might find in this time is that babies have a little snooze. The mistake that some of us mums make is that we might take the baby off at this point because you think, oh, you know, they're just comfort feeding, which is not a negative thing, because as we said earlier, it's a lot to do with the nurturing, it's a lot to do with the brain development, all these kind of things, just having that closeness. But they might just have a rest. It's like us having a rest in between courses. Okay, so again, they might start again, a couple of sucks and a swallow, a couple of sucks and a swallow, and you can hear that kind of swallowing noise. Your midwife, or if you end up having a video call with ourselves, we can go over what to look for too. So again, really important that babies then go on to the third stage of the feed. So you can see the difference, that there's a lot less volume with the second part. This is not what we're expecting babies to get, this is just so that you can see, but there's a lot less volume, but you can see there's a lot more fat content in this second stage of the milk. So again, you might think, oh my goodness, the little one's so tired, they don't seem to be doing much at the breast, they're maybe having a little chin quiver, or what I usually say is they look like the nodding dogs off the back of car window ledges. So you might find that that's what they're looking like. What they're doing, it's not that they're not getting anything, this is when they are getting this seriously high calorie, high fat content milk that's really important for development, really important for weight gain, and you can see the difference. As I say, they don't look like they're doing much at this point, but this is when the milk changes yet again. So you can see the comparison with what we were talking about earlier, about comparing breast milk with formula. You can see how that milk changes. It changes if the baby's thirsty, it changes if the baby's hungry, but it also changes throughout the feed. So you can see the difference. It's starting to do, even just with the oil and water, it's starting to look more mature, kind of thicker. So the volume goes down, but the calories and fat content go up. So it's really important that they get to this stage. Now what you find when babies do get to this stage and their tummies are nice and full, they come off and they almost look milk drunk, or sort of almost just flat out. Okay, so that's just a whistle-stop tour of what to look for with your baby's breastfeeding behaviour.
So we're going to have a look at position and attachment. Attaching your baby to the breast is key to successful breastfeeding. But first of all, I'm going to talk you through how we should get ourselves comfy. So it's really important that we never sit on the edge of a chair. I never want to see anybody on the edge of a chair or the edge of a bed, because we've got to maintain the position for feeding, and we don't want anybody getting a sore back. So it's really important we're supported in the back of the chair, or if you're on the bed, some pillows in behind you. And we also make sure that we've probably nipped to the loo before feeding baby. So again, going back to our feeding cues, if we start to see baby stirring, that's that key moment for grabbing a drink of water and ensuring that you have nipped to the loo, etc. So, for baby, we've got our backs nice and comfy. For baby, what we're aiming for is that baby is turned right over towards you. So we're looking at your baby's tummy being right over to your tummy, never facing the sky. Because if baby's tummy is facing the sky, it means that it has to twist its head for feeding. And I don't know about anybody out there, but trying to eat your meal with your head twisted is not very sustainable. So, right over to you. We suggest that you hold babies in the nape of the neck. Why do we ask you to do that? Because yes, it does feel a bit alien to begin with. Well, if we hold a baby around the head, it restricts your baby's movement, and we're looking for a baby to be able to flex its head to latch to the breast. So we must make sure that we hold a baby in the nape of the neck so your baby has that flexibility for getting that really good latch. So tummy over to you, holding baby into the nape of the neck, and we're looking for the shoulders and the hips through to the feet to be in a nice line. And this way we should be able to hold baby and have a nice comfy position, and you should be able to support your baby with your arm well.
Okay, so why is a good latch so important? Two main things. One, we don't want you mums being sore. It's a bit of a myth out there that breastfeeding has to be sore, and it's always sore in the early days. You can get a bit of discomfort just because your breast may not have been utilised like that before. But it also helps with the milk transfer. That sounds very clinical, but the milk transfer to the baby. So it ensures that your baby is going through the stages of the feed that we talked about earlier. So what are we looking for when a baby latches to the breast? So with the positions that Jenny has talked about, you also have rugby ball position, you have what is really natural for a baby is the laid back position, also called biological nurturing.
Do you want me to do that?
I'll let Jenny show you just now.
You might as well demonstrate. So you probably need to put a bit of a slant on yourself, so you need to be comfy, slide down, probably cushion into your lower back, and your baby comes more upright towards you. This is more natural position for a baby to be.
So it's almost going from a skin to skin position, which feels natural, and letting baby do some of the hard work. That's always important. So when a baby latches to the breast, it doesn't matter what position they're in, the principles around it are always the same. Okay, so it might feel, as Jenny was saying earlier, some of the things might feel a bit awkward to start with, but please don't expect on day one to know everything straight away. Your confidence will grow in a relatively short period of time, but that's when you can contact us as well, just for a chat. Okay, so what we're looking, if you imagine whatever position we're in, whichever way the breast is sitting, what we talk about sometimes as well is, and I apologise for the use of language, but going with the angle of the dangle. So it depends on how your breast sits is where your baby will come onto the breast. But again, principle's all the same. So when your baby's going to the breast, when you've got into a comfy position, you've got your box set, you've got your TV diddler, you've got your phone, you've got your loud chocolate, or all your healthy snacks round about you. What we're looking for when a baby is close in, as Jenny was saying, we're then looking for, if you imagine this being baby's mouth, obviously I've got my trusty fake breast here. We're looking for baby's nose, so that's my top fingers here, baby's nose going to the nipple, so just under here, resting next to the nipple. This will feel strange, okay, because we're expecting the baby to go on with their mouth straight away. But as you can see, even with me doing that, if baby goes on straight away, your nipple is then being rubbed against the hard palate. This is where most mums find, if they do have pain, that's where that comes from. Okay, so to help prevent that, and if you are feeling a bit sore, to help benefit you, nose to nipple, baby's chin in first. So their chin acts as an anchor, so it anchors the baby's chin against your breast, so they're not sort of going all over the place, and you don't have to rush them into the breast. Nose to nipple, chin in first. Big wide open mouth, and baby will then move their neck back, so that helps with the big wide open mouth, up and over the nipple, and then you can see even with this that the nipple is cushioned at the soft palate right at the back of the throat, and this is hopefully what's going to prevent you feeling any discomfort. So getting a good latch, as well as talking about how much how much milk the baby gets from a feed, but also talking about your discomfort. This also helps prevent any of the nasties that a lot of mums have heard about to do with breastfeeding. Okay, so this is where I say please persevere with the latch and not the pain, and never feel you can't get in touch to ask any questions or if you need a little bit of advice. Okay.
The other place you can have a look at a really good video of position attachment is the UNICEF Baby Friendly website. If you go to their homepage, and it has parent support on it, and then if you scroll down the parent support page, there is a link for position and attachment, and it has a fabulous video which shows like an animation of where the nipple sits in a baby's mouth and the milk transfer, and it's really worth a watch. So I would advise anybody who would like to look into this a bit further to go onto the UNICEF Baby Friendly website and have a look at that.
So we all have expectations of what our breastfeeding journey might be like, and preparation can be a big part of that, things that can help. So getting to know your breasts before baby's born, we talk to our babies, we get to know them from when they're on the inside, but actually from a physical point of view, because your breasts do change during your pregnancy, it's good to get to know what is normal for you, so then you can recognise any changes after the baby's born.
It's really, really important we respond to our baby's communication cues, as we talked about earlier on. It's not normal for a baby to learn the likes of controlled crying and things that you maybe have heard about. A baby has no idea about what controlled crying is. All a baby is looking for is security and safety. And it's really important when your baby shows signs that it's looking for a cuddle or looking for feeding, that we respond to that. But it's also important for us as mums to respond back, as in if you're feeling a little bit full, if you feel that you need to feed your baby, it's also okay for us to respond that way and pick our baby up and feed our babies. It's really good for our milk supplies and that good bonding, nurturing relationship that we're aiming to build.
And please remember, you cannot spoil a newborn baby. Just like we can't overfeed a breastfed baby, you cannot spoil them. So cuddles are good.
Yeah.
So although we are perfectly aware that we are not with your babies 24 hours a day and nobody fits into the same plan for their breastfeeding journey, we do suggest that you try not to use any kind of dummies or nipple shields or the teats of a bottle. Now that's not just us being cruel. The point of us telling you that is because if you think about how a baby attaches to any one of these three things, they go in with a shallow latch. Now that's not going to help you, okay? So this is teaching a baby to go on with the shallow latch again rather than that big wide open mouth. Now the reason we say about dummies is as well that dummies are very good at masking feeding cues. So you tend to find a baby that's been sucking for a while thinking, wait a minute, I'm not getting any food here. We'll spit the dummy out and go from 0 to 60 with the feeding cues. So we'll be a bit more fractious, maybe a bit more upset. And as Jenny was saying as well about the last feeding cue being crying, that makes it more difficult for you. And as mums, we're more likely to put up with pain that we don't need to. And the same with nipple shields. Nipple shields are they're little kind of latex silicone covers that go over the nipple. If you can avoid them, please do. They do have their place, but chat to either us or your midwife or MC about that, or your health visitor. The danger of them is that they can, over time, reduce your milk supply, but it also changes that latch.
It's really, really important that we key into people that can be supportive, certainly within the early days. Now, as it stands at the minute, sadly the support groups out in the community aren't running because of COVID-19, and we're trying to be really safe. However, we are here and we are hoping that we are going to be setting up some virtual support groups so we can speak to other mums and we can use that peer support. Speaking to other mums who have been in the early days in breastfeeding and have come through that, and you can see the positivity that's come from that, is really, really important, and it really does build your confidence, because sometimes we can sit at home and we can feel a bit isolated, certainly I know at this time, but also out with COVID, we can feel isolated within four walls, and speaking to people that have been there normalizes what you're going through. And I think that it's really important, and Andrea and myself have both run the breastfeeding groups, and the outcomes that we get and the positivity, isn't it, from the moms and how they feed off of each other is really, really amazing, and we feel very privileged to be a part of their lives. So we are hopeful that we can include you in some kind of network once your babies are here.
And within that network, you know, the mums can give you so many different ideas. It's not, we don't want you overwhelmed by things, and my kind of thing is always filtered what advice you're giving. You might have great Auntie Aggie coming and saying you're spoiling your baby, you might be told that you're building a rod for your own back, you might be questioned whether, were you feeding the baby again? Yes you are, and all those things are good because we talk about responsive feeding, we talk about being responsive to your baby. That is so amazing for the baby's brain development, but also just for that close time for you to get to know the little one. So definitely filter what advice you're given. This includes social media and includes what's online. If you're in any doubt at all about anything, then please give us a shout.
And I think also, feeding on from what Andrew's just said, one of the key things people says is, does your baby sleep? Well actually, yeah, your baby does sleep, and your baby does sleep quite a bit over the period of 24 hours. But your baby's not going to sleep as we could possibly sleep as an adult. Your baby's not going to sleep 6, 7, 8 hours. And we as health professionals don't want your babies sleeping for 6, 7, 8 hours because we don't see that as safe. It's really important that babies are up, they're stimulated, you chat to your baby and you feed your babies for the safety purposes. So yes, your baby does sleep, but it doesn't sleep in the early days as some people expect a baby to.
And they definitely haven't been born wearing a watch.
So practical ideas and help from friends and family. It's really important that we utilise our friends and family to our own advantage. Some family members may think taking the baby away is what helps the mum, and actually the baby isn't what the problem is. I think as mums we worry about, oh, I've not put my washing out, or maybe I've not got around to my dishes, maybe I'm still sat in my pyjamas. That's all absolutely fine, and it's really important, and we say to people all the time, you don't have to be a superwoman when you're a new mom. You just need to nurture yourself and nurture your baby, and hopefully the rest will take care of itself. And meaning that, utilise your friends and family to hopefully take care of some of that and lighten your load. Just try and focus on yourself, looking after your baby, and sort of just sinking into a little bit of a bubble, certainly during the early days, and trying not to worry about the things that probably aren't that significant and do sort themselves out over the course of the day.
Along with the practical ideas from friends and families, other mums, whether this be virtually or whether it be face-to-face, there are a lot of things that come sort of later down the line. So if you do need advice about, we don't advise, unless you have to for whatever reason, we don't advise that you start expressing for at least the first 6 weeks. But if you need advice about going back to work, or if you're questioning things about expressing, then that's something we can talk about as well. Okay, so please don't hesitate to give us a shout.
So we talked about looking after yourself too. It's really important if you do get that moment to go and have 10 minutes in a bath, have a shower, make yourself a cup of tea. You know, it sounds simple things, but when you've got a new baby and you've got all your focus on this baby and trying to be a good mom, and you know, your baby's your whole world, but it is important that we do take a step out of that when we can, and partners or somebody there to help you do that, to sort of nurture yourself a bit. And it's really important that we keep ourselves well hydrated, and we try and maintain a good diet, and we have long-lasting carbs, because it's really important that we try and fuel ourselves in order to fuel our babies.
And you will be so chuffed with yourself, and you will realise what an achievement it is. The first time that you managed to go to the loo yourself, the first time you managed to finish one whole warm or hot cup of tea, all these things are so important. It's a bit of a myth when we say, oh, sleep when the baby's sleeping, but please rest when the baby's sleeping. Whether that be in, you know, watching your box sets or whatever.
Absolutely.
This is a biggie for both Jenny and myself. There are never any silly questions. You can contact us as often as you like, and you can ask whatever you like. Now, we are dedicated, but we do not have our phones on at 2 o'clock in the morning, but you are welcome to text then, and we would respond to you as soon as we get your message.
We also have the NHS Dumfries and Galloway breastfeeding page, which you're more than welcome to join, and that gives a massive peer support. We have hundreds of people on the page, experienced breastfeeding mums, as well as myself and Andrew are on the page as well, and you could put a question on at 2 o'clock in the morning, and I'm sure somebody will respond to you, because there will be somebody up at the same time as you feeding their baby.
And it's good to have a Facebook page that you know is monitored by us as well. We also have our wonderful volunteers on there as well, and if volunteering is ever anything that you're interested in, please give us a shout. So as mums, some of us have very definite views of how we're going to feed our baby, how we're going to parent our baby. Others are sitting on the fence and we aren't sure. I would always say, if there's any doubt there, please give breastfeeding a go. So I hope we've managed to answer some of your questions, maybe about your expectations too. What's normal breastfeeding behaviour? What do we look for? We look for wet and dirty nappies, we look for a good latch. We know that nighttime feeds are particularly important, especially because your prolactin, your milk producing hormone, is at its highest during the night. We want to keep it real for you. We want to be here for you. We want to know that actually you don't need much equipment. We want you to know that things like breast size shouldn't make a difference, but there are maybe different positions that will help you along the way. We want you to know that your baby will feed frequently. This will change over time. So you'll get used to one way and then your baby will change into another one, but that's okay. We want you to know that you're not on your own. We're here, but others can get involved too. We want you to know that your confidence will grow, but we're here to help with that too. Breastfeeding can have such a positive effect on your mental health. We know that having a newborn is tiring. We know that breastfeeding can be tiring too. We are not doing the rose-tinted version of the information that we're giving you, but it's known that there are people here that will help you through your journey. So please remember to give yourself time, give yourself a mental break. Know that it can take up to 6 weeks for breastfeeding just to fall into place, for the supply and demand to just fall into place. That's okay, and that we're here with you for the journey.
I found a lovely quote online, which I'm going to read to you just to round this off, and I think it kind of just signifies the power of breast milk. And I know Andrea and I could talk all day about breast milk and how amazing we think it is. We sort of talk about it like liquid gold, but I think this quote, I don't know, for me it just summed up sort of where we are. And I guess people wonder why we try to get people to breastfeed, and it really is because the relationship that you can build with your baby is really special, but also what you're offering your baby is something that you will never be able to provide through any other source. So imagine that the world had created a new dream product to feed and immunise everyone born on Earth. Imagine also that it was available everywhere, required no storage or delivery, and helped mothers plan their families and reduce the risk of cancer. Then imagine that the world refused to use it. Andrea and I wish you the very best of luck, and as we've said a few times now, don't hesitate to contact us, don't hesitate to contact your midwife if you're stuck, your MCAs, and there's also health visitors. There are people there to speak to throughout the early days, I suppose, along your journey as a mother. So please speak to somebody if there's anything that you wish to ask.